were those who suggested they could do it cheaper. Give us a special model out there and launch it as a pilot, and we'll show you how we can do these special programmings and give us a return. Well, after reviewing now what is a history of all of that, it was deemed that there were overpayments of anywhere from 12 to 14%. And so the dollars were slid over to programs like filling the donut hole and providing for screenings for our seniors, not taking it away from a category of healthcare consumers, in this case an age demographic of seniors, but taking those savings as we sweep those savings and reinvesting them in a way that provides balance, more sensitivity for the consumer, rather than having record profits developed for an industry. To me, that was progressive policy. And for people to then take those savings and use them in their own budget presentations for other purposes was disingenuous. Now, when you talk about the efforts today of the Affordable Care Act to include an exchange, what I think is oftentimes lost, Representative Garamendi, is that people see this as some sort of public exchange that's going to be run by the government, when in fact we set up an exchange and the private sector sources come to the table if they're willing to abide by the rules, if they're going to govern themselves by the parameters that have been established in the legislation, they can then offer services through the exchange. So it's a private sector solution, but with new caveats of parameters that are established so as to provide benefit for the consumer. And when you think of it, if there are firms that hire 10 people and one of those 10 becomes catastrophically ill, the actuarial impact of that one individual circumstance can drive premiums up for that small business in very high order. That kind of impact is unacceptable for the small business community that today pays some 18% more for their insurance and oftentimes get weaker coverage. With the benefits of an exchange that is private sector driven, you now have the opportunities that people can have that actuarial measurement made in a pool of perhaps millions, so that the unsteady and unpredictable kind of outcome for small business is now rendered more efficient and more sensitive by shaving the peaks that may occur in a universe as small as 10 people. So there is a science to this. There is thoughtfulness that has been pumped into the discussion. And by inserting that thoughtfulness, we have come up with reforms that really speak to a wiser use of this country's health care dollars. To then move to repeal before a number of these programs are even implemented, it was a folding in of progress over the course of several years now that was initiated with the passage a couple of years ago that needed time to work. And for people to just play politics with the lives of individuals, with the health care quality of individuals, is regrettable. And for us then to be asked to visit for the 31st time a repeal exercise in some 19 consecutive months, we used this week of session in Congress to debate for hours, to message for hours, to come to the floor for votes. These were session days that were used up for a repeat of an exercise that time and time and time again has been conducted just to politically posture. When in fact the American public is saying, look, you voted on this. Look, the President signed it into law. Look, the Supreme Court, the highest court in the land, conservative-leaning court, has ruled constitutionality. They want us to move forward with job creation, responding to the cures this economy needs. We started with a terrible pit of a recession. 8.2 million jobs lost. 800,000 jobs being lost per month as this administration started. And ironically, when I started my service in the House of Representatives. We are in a dark, deep hole. and to come out of that with 29 consecutive months of private sector job growth, to come out of that with over 4 million jobs created in the private sector, and to go forward with an effort to reform our health care system in a way that extends greater opportunity, beacons of hope to families, individuals, those catastrophically ill, those denied because of pre-existing conditions, pharmaceuticals, unaffordable for many seniors. To have all of that turned around and have all of this progress of the comeback trail from the recessionary period that was far too long and far too deep and far too painful than anyone ever forecasted, to strike that kind of progress and then have it met with 31 consecutive efforts to repeal the situation is regrettable. It's regrettable. Representative Garamendi, you've been here for those 31 efforts. Has anything changed? It's the same old that's being expressed out there that does not, I think, meet with the concerns of individuals out